Dan, what brings you to the conference today?
Well, first of all, most importantly, Mei Lin brought me to the conference, and really appreciate her introducing me to all these people that have so much to contribute. And what brings me here is basically we've looked over the last 5 or 6 years on innovative new ways of collaborating to improve 3 major factors: health, wellness, and resilience. And what we found is that the efforts were distinct between the government, the private sector, and the nonprofit world. And so what brought us together at this one is we've been working through a project called The Beach out of San Diego, appropriately, to align those 3 efforts and to be able to sustain projects over a longer period of time. A little background on The Beach. It actually stands for something. It's the Beacon Education Analytic and Coordination Hub, and it comes under the University of California, San Diego. They received a grant for about $15 million for a program called the Beacon to do electronic health records, but also forward-leaning activities. And what they found over the 3 years of the grant was that the projects were technically complete, but they weren't sustainable. They weren't really bringing people on board to build momentum behind it. So in the last year or so of the project, they decided to transform that and to forward-leaning with the Beach, which is afterwards, working with 17 other communities across the country. And one of the innovative pilots under that is called the California Health Corps, which is a project that Mei Lin started up in Northern California in the Bay Area to actually bring people together to address those 3 things.
And what are the prime issues that you feel need to be repaired?
Well, it's not that it's just more money, and it's not that the willingness isn't there. It's how can we be more effective with the resources and money that we have. And part of that is building a common understanding of all the stakeholders. When you talk about health, it could be a person, it could be an individual, it could be a family, and everyone has good intentions. And so one of the things that the Beach brought forward and the California Health Corps is really extending on is how do we become all-inclusive to really focus on the total wellness of the community and the individual, but at the same time be able to apply technology and new issues forward. So it's really building a common language across the stakeholders that come from different perspectives.
When you talk about stakeholders, are you including doctors, hospitals, insurance companies?
Yeah, so we're talking the entire private sector. So when you look, and we have a couple of good examples of this, when you look at emergency medicine, well, the ambulance company has a stake in this because they treat patients and they actually treat the patients before they go to the emergency department, but they also transport them, and there's a cost for doing that. Hospitals have a cost if someone comes in the emergency department who they think might have a cardiovascular condition where they have to put a stent in or something. It costs money to do that. By building their relationship to provide better care and more appropriate care, it can also be less costly for them to do that. So it includes hospitals, clinics, providers, provider networks, new things called affordable care organizations. So it's the entire community of this and the private sector businesses. So lots of large corporations actually have health people working within large corporations.
Now, the internet seems to be playing a role in this also, because in many places now, it used to be that if you went to a doctor's appointment and then you couldn't remember what he told you, it would be hard to access him again to find out. But now you can send him an email and somebody on this team will get back to you.
Yeah, that's so a big driver for this, as I mentioned before, is the University of California, San Diego. The 2 doctors, Dr. Ted Chan and James Collane, they were funded under something called high tech, which is high technology, electronic health records, and those types of activities. And there are multiple stages for this called meaningful use. This actually brings meaningful use with the technology with the actual consumers of relevant use, which are the patient and the people that are providing the care and the pharmacies. But it also includes the family. So that's one of the big pieces with this is if you, I have elderly in-laws and parents, and when they come back they say, well, I think the doctor told me this. How can you actually find out what they meant? And so part of this is to really bring it to the entire family and community.
And you think patients need to take more responsibility for their own well-being instead of saying, well, you're the doctor, you went to medical school, I'm depending on you to tell me what to do, but ask the right questions.
Yeah, so let me put it to you this way. One of the, Dr. Klein, one of the things he said, he's an emergency room doctor. So he says, I provide great care and the most expensive care. The more I know about the patient, and the more the patient, and that's one of the things, ambulances are sending them data beforehand. The more I know about them, the better care I can provide them. I can't remember your entire life. If it's an electronic health records, and you're 70, 80 years old, you have a lot of records. How do you distill that down to actually treat the person? It's truly got to be a relationship between the clinician, the doctor, and the patient to really make this work.
Do we need some new paradigms of medicine? Because medicine seems to be one of the worst bargains for your dollar these days. You know, if you buy a new computer this year, you'll get more computer for your dollar than the one you bought last year. But if you buy medical care this year, you'll probably get less value for your dollar than you got last year. I mean, why is that, assuming it's true?
Well, it is a challenge, and it's been an ongoing challenge that's been a little bit in the news lately. But I think one of the best ways to look at it is this. You mentioned the internet. There's more data that's out there, and there are some really innovative people, especially with cancer, that are actually looking at determining what cancer drug would be most effective for you. And once I started giving you that drug, can I change it? And they're really doing it, and it's big data, all these terms, big data and analytics. But what's happening is it's going to take, like you said, the patient, the person to realize that they have the ability to have a well and healthy life as opposed to being sick. So it's really a change in the individual that will drive the change forward. The government can only do so much, but it's really a change in the individual, and that's education.
Now, there's a big effort right now to give the government more control over health care through Obamacare. Do you think that that's a sound concept? Do you think the whole premise of that makes sense?
You need to drive change. And the Affordable Care Act, or Obamacare as it's commonly known, we have to affect change. Kaiser's done a lot of these things for a number of years, and we have to try new things out. But there also needs to be a willingness to say, that wasn't working that well, how about if we change it a little bit? And so one of these things is we have to have an adaptive nature, but if it doesn't come from the feedback of the people receiving the care, then it's going to just be another bureaucracy problem, and it's not going to actually be able to be resolved.
Now, what's your main role in this? Are you mostly concerned with developing the communication platform, or are you more at the technical end, how to deliver?
Well, I'm a dual mode person in this. My background is in information technology, but when we looked at this, my group that I work with at the CME group, we really focused on how do you exchange data, more like a visa between partners. And there are a lot of people who actually utilize the data and apply it. Kevin Montgomery, one of the people speaking here, has an excellent platform for those types of analytics. There's the National Lambda Rail, a lot of people who can use the data. Watson from IBM. What we really found, though, is when you have to exchange data, you have to get along with everybody. So one of the things is we have to reach across to the private sector, the small practice, the large healthcare system, public health, emergency medical services, the government, and nonprofits. And how do we get them to understand by sharing data, they will all be more effective?
Now, how do you implement the change? Because most big organizations have an innate resistance to change. They have something that works for them. Change is complicated.
Well, I'll do this in two places. Let's take a large organization like the United States government. And one speaker in testimony said, the one thing about the United States government is we talk about the interagency process and how we have to innovate and be adaptive. And bureaucracy is designed to avoid rapid change because you can make a lot of mistakes if you change too quickly. Part of this is finding where the value proposition is, if it's better care or combination of value propositions. And identifying that a lot of times means you have to listen to what they're doing to help them to understand what their value proposition is, because they've been doing it the same way so long. But we've been able to get large organizations, large healthcare systems to realize that they can, by working together, they can not just provide better care, they can also save money doing it. And it's not, so it was a driver to the, if you asked about Affordable Care Act, with that, it was a driver to people to look at how they're doing business and say, is there another way? we're not there yet, but as long as people start working together more so, the nonprofit, the government, and the private sector, I think we'll see some good innovations in the next coming years.
Okay, very good. Anything you'd like to add before we wrap? Assuming you're talking to a large audience?
Yeah, to the large audience, it is about you. It is about the people, the individual, and the family, and the community. And if you really look at it, a lot of times we say we say, I don't feel well today, I'm sick. The assumption has to be that we are well. And if we start thinking that we are well and being sick should be an exception to the process, and we can come back to it, I think we'll all be better off for that and a lot happier, which I think is an intangible benefit of being healthy.
Okay, very good. Dan
Thank you very
Desmond,
much.
thank you very much.
Thank you, sir.
Okay.